front, around the side. It gives us perfect access to the cuff, but if you add up the length of all these tiny little incisions, it probably wouldn't be that much different than a mini open. The difference is that you can do things that you can't do from the mouth of the bottle. So how do these things actually compare with traditional surgery? Well, across the board, if you look at all the different studies, and I'm going to concentrate mostly on studies that are more recent because I think that this is developed as a technology. So the more recent studies are probably telling us somewhat more about where the state of the art stands now. People get about 93% to 95% good or excellent results with arthroscopic cuff repairs. What's interesting is that there's not much difference in the results depending on the tear size. Now what I mean by that is with the old way of doing things, the mini open repair, people who had small tears traditionally did great. People who had big tears did not as great. With arthroscopy, people with small tears do pretty well, and people with really huge tears do pretty well. There's not a big difference from one tear size to the other. The re-tear rates are higher with arthroscopy in some of the studies that are out. What's interesting is that a lot of the people are very satisfied with their surgery and would have it again, but if you get an MRI on their shoulder, they still have a small cuff tear. So again, we get back to the stage where we're probably restoring the function of the cuff with some of these techniques, but maybe not exactly getting it to heal down all the way, and that probably is going to be a problem we solve as we get better fixation methods to the bone. The last thing is that the long-term durability of these cuff repairs is just not known. You know, we know how the way we did it 10 years ago lasted, and we know how the way we did it 1 year ago lasted, but I can't tell you if the way we did it 1 year ago or we're doing it now is going to last for 10 years. And so those results are still cooking, if you will. I think, though, if you ask people who'd been told by their surgeons or told by other people or suffered with shoulder pain for a long time how some of these arthroscopic methods work out, I think they'd tell you they were pretty happy. You're looking here at 3 patients who I've done not too distantly who are doing great. These folks all had these massive rotator cuff tears. They were told that they were inoperable. People looked at the MRIs and just kind of ran away and said, well, you're going to just have to let the shoulder kind of go to pot and then eventually have an arthroplasty done. And or arthroplasty being a shoulder replacement done if the shoulder breaks down. But again, using these kind of painstaking ways, you can sew these cuffs up. And I think if you can get people a fair bit of time and a functional shoulder that allows them to do the things they like to do, we've sort of won the race, so to speak. So I'd like to say thanks a lot, and I'll take any questions you folks have.
Do athletes who suffer this kind of injury, they have arthroscopic surgery, do they get back to the same level of activity that they were used to? Or? It's
a great question. And it's complex, but the general answer is yes. Between about 85 and 95% of people who have a rotator cuff tear fixed arthroscopically will get back to the same or a higher level of competition. This depends on several issues, and it's a bit of a loaded question only because the shoulder that gets a rotator cuff tear, unless it was a traumatic injury, there's probably a secondary reason why this is happening. And it can be difficult to, and it's important that the surgeon figures out and solves all the issues that are leading to the cuff tear. And those are the things that can prohibit people from getting back. But in general, the answer to the question is that it's a successful surgery and that people get back. Although the codicil to that question, and you haven't asked it, but I think people are wondering is, are they getting back quicker? And as we've answered before, I don't think you actually get back quicker. I wouldn't do an arthroscopic procedure because I thought I was going to get someone on the field quicker. But I would do it because I think that I can do a better job through the scope with a particular type of surgery. Well, I'd like to thank everybody for coming here and sitting through this. And if there are questions that you want to ask that you didn't want to ask in front of other people, I'll be here for a few minutes to answer those sort of questions as well.